thank you, Shirley, and I want to thank Shirley and Marius for inviting me today. This is my first time at the Mindful Migraine, so thank you all for coming today. Spending some of your Saturday time. So I'm going to talk to you about maybe some things that you haven't heard about before. Some emerging psychotherapies for chronic pain, pain reprocessing therapy, and something called emotional awareness and expression therapy. And which button am I supposed to push? Did you say?
The right hand button, please.
Right hand and an in here.
Mm-hmm.
Oh, maybe I just. Okay. So this is an AI picture of. I think that's supposed to be me from maybe 15 years ago. When I didn't have gray hair and I had more hair. So this in 2018, I was a psychologist. I work in Boulder County, and I was working in an integrated healthcare, managing a chronic pain program for the most needy patients in Boulder County. So a lot of folks who were homeless and on Medicaid and really dealing with some pretty serious conditions. And we had a group-based cognitive behavioral therapy program, which helped a lot of people. But we never really saw people really step into recovery. People's lives improved, but it was kind of marginal, the kind of gains that you would see with people. And then, all right. Okay, and then later that year, I had a young CU intern who walked into my office and was talking about this new therapy that they were researching called Pain Reprocessing Therapy, and that they were having a lot of success at really getting people into recovery from chronic pain. They were specifically focusing on back pain, but they were really able to get people significantly out of pain. So I thought, at first I sort of laughed this off. I thought, this isn't, people can't really fully recover from chronic pain. It's just something that people have to manage for the rest of their lives. And so I sort of laughed it off. And then at the end of the year, he did a presentation with us about pain reprocessing therapy and showed us the results of the Boulder back pain study, where they had 2/3 of their patients in the study had gotten almost completely out of pain. And he had a patient who described her experience of having chronic migraines and chronic back pain. She was almost completely out of pain. And I was just shocked. I didn't realize that this was even a possibility. This is a picture of me now with gray hair, and you can see I'm grabbing my back and my head because I have both chronic back pain and have had chronic tension headaches and vestibular migraines. And so as I was, as this CU intern was leading us through the process of pain reprocessing therapy, I realized that this was also a story about me. That I had, my vestibular migraines were more episodic. I would have something like once a week, but I was really suffering. I missed work regularly, living in fear of the next attack. And during one of the pain reprocessing therapy exercises, which I'll lead you through, which is a kind of mindfulness-based exercise, I realized that I had developed an intensely phobic relationship to my own sensations, especially anything having to do with pressure in my head or neck. Even without a headache, even when I didn't have a headache, I was very afraid, as I'm sure people here can relate to, any kind of sensation that I would have in my head. I also realized as we were doing this pain pain reprocessing therapy training that I was under a tremendous amount of stress. I had a very stressful job. This was during COVID time. If anyone remembers that time, that was a very stressful time. I was going to work with masks. Lots of people were very upset. It was a very stressful time to be. Healthcare is a stressful time to be alive. And I realized that I was regularly in a state of overwhelm. I was very much in this cycle of pain, fear, pain, fear. And this is something that in pain reprocessing therapy, which is based on some of the latest neuroscience around pain, we understand that what's happening with chronic pain in a very, very simple way, we'll get into a little bit more of the complexity of it, is that pain and fear feed off each other. And the more that you are afraid, the more that that feeds into the pain, and you get into a very vicious cycle. And I was very much stuck in that cycle myself. And I realized in that moment of doing the pain reprocessing therapy training that there might be a different way, that I might not just have to be a passive sort of victim or receiver of my migraines and headaches, but there might be something that I could do, that I could be more active. So I engaged in a process of what I now think of as self-directed neuroplasticity. Has anybody heard this word neuroplasticity? It's kind of a big word. Basically, what neuroplasticity is, and there's a whole emerging science of neuroplasticity, as we're learning that the brain is more capable of change than we realize that it is. This is the brain that changes itself is a title of a really interesting book about neuroplasticity. It's also, I want to point out, the book that Shirley was mentioning earlier by Morgan Fitzgerald is a really excellent book about engaging in neuroplasticity to train your brain to step out of that pain fear cycle. So I'm going to describe what some of those steps are, some of which you can do with a therapist, and also some of which you can work on your own. Okay, so the first step that's very helpful for me, and I still think about this a lot, is understanding the basic science of pain. So one thing I learned from Lorimer Mosley, the neuroscientist and pain researcher in Australia, is that pain is really an output of the brain, not an input. We think about pain as being an input, but it's really an output. Our brain is receiving signals from the body, and then the brain has to decide to interpret those signals as pain. And pain is much more proportional to our unconscious sense of danger than any actual indicator of damage. So you can think of pain as like a smoke alarm. Sometimes it signals a real fire, but often, especially in chronic migraines, it's actually just burnt toast. The system has become overly sensitized. And the smoke, like the signals from your body, is very real, but it's not actually dangerous. So the alarm is also very real, but it's not actually indicating anything that's actually dangerous. So this is another analogy to think of as like a car alarm, where the soccer ball is hitting the car. And so the soccer ball is very real, but there's actually no damage happening to it. So in chronic migraines and other chronic pain conditions, this becomes a very vicious cycle. Pain creates fear, which cranks up the alarm, which cranks up more pain. And in order to break the cycle, thank you. Maybe it's easier if I just have fewer events. So we're going to practice this. In order to break the cycle, curiosity, safety, and compassion are the keys. And we'll practice that. if you could advance. Okay, this is another diagram that I think about a lot, and I use it myself with clients, and I just think about this a lot. Is that so? If you think about pain, is the brain's danger detector going on, leads to pain, and the natural way we respond to pain is with one of the with fear, but fear can take other forms. We talk about the 5 F's: fight, frustration, focus, fixating on it. All of those are giving our brain the message that whatever is happening in our body is dangerous. And so these are incredibly natural ways to respond. But going back to what Lindsay was saying with the brain's negativity bias, and that is an excellent book there, Rick Hansen book, by the way, Hardwiring Happiness. He talks a lot about that. So this is going to ramp up our brain's negativity bias. And so what we want to do is find a way to counter. Is there a way we can respond to our sensations without fear, without fight, without frustration, without trying to fix it? Okay, you could advance. Yes, and I just want to emphasize, this is not to say that pain is not real. Pain is always, always real, and it's always in the nervous system. And what's happening with migraine and other chronic pain conditions is it's gotten entrained into our nervous system. And what we want to try and do through neuroplasticity is see to what extent we can unlearn it. How am I doing on time? I will not go
Like 10 minutes.
10 minutes, okay. So there is a really interesting part about how the brain works, which is that the brain is big. We're coming to understand that our brain is very much based on prediction. We're constantly predicting. And this also goes back to what Lindsay was talking about. You can get into a pattern where you're constantly predicting that negativity, constantly predicting pain. And then that is what you start to experience. So I want to show you let's see if we have time. So I want to show you this example of predictive processing and how the brain works.
Have you ever been someplace the way
Uh,
far?
I guess I need the next slide. Oh, pain can be learned and pain can be unlearned, but you have to train your brain. This is from the book that I was mentioning earlier. I'm not going to read this whole slide, but just very, well, it's not to say that migraines are a neurological disease triggered by genetics, hormonal changes, and environmental factors. These factors play an important role, but modern science has revealed that chronic migraine is not just the result of external triggers. It is also shaped by the brain's sensory processing systems. And that's what we're trying to retrain in pain reprocessing therapy. Okay, I'm just going to skip that. So what is pain reprocessing therapy? So the key thing that we're trying to do here is break free. We're trying to break free. And learning to turn down the fear and ratchet down the smoke alarm sensitivity. So this is a summary of pain reprocessing therapy, the process. The first step is something we're already doing right now, which is understanding neuroplasticity, understanding that the brain, if the brain can learn pain, it can also unlearn pain. Healthy coping and soothing when symptoms are high. I think in some sense this is obvious, but in some sense it's not. It's the idea of when you are having a really bad migraine attack, that you really want to step out of criticizing yourself, being negative with yourself. You want to step out of fear and see if you can shift into soothing and comfort. The third step, though, is often something that people haven't done, which is somatic tracking when symptoms are low. And And then the fourth step also is not often done, but gradually exposing yourself to triggers in a safe way and calming your nervous system. Leaning into positive sensations and feelings, feeling and expressing avoided emotions, and making changes in your life to decrease your stress and increase your joy. So some of these, I think, are things that people are already doing, I'm sure. But I want to give you guys a taste of somatic training. So this we'll just do, because I want to give you guys an experiential taste. This is a kind of mindfulness exercise that we use in pain reprocessing therapy. And the whole idea is being able to experience sensations in your body from a lens of safety and not from a lens of fear. Okay. So if everyone could take a comfortable position and close your eyes for a moment. Just let yourself breathe and have a moment of relaxation. Okay, now I want you to tune in to some part of your body that has a little bit of discomfort. If it's too much discomfort, let's not choose that, but something that has a little bit of discomfort. Could be tension, could be pain, some part of your body that's sort of calling out to you. And it could be in your head, shoulders, it really could be anywhere. Now I want you to see if you can start by just allowing it. Don't judge it or push it away, but see if you can just allow it and breathe with it. See if you can kind of breathe into it, breathe with it. And now, as neutrally as you can, describe it or name it to yourself. Is it pressure, pulsing, tightness? See if you can just describe it and name it. And instead of asking, how bad is this? Is this going to get worse? See if you can just observe it. Allow it to do whatever it's going to do. And ask yourself, if it were a color, what color would it be? If it were a shape, what shape would it be? I want you to try saying to yourself, this sensation, just this sensation, is safe to feel. In this moment, I am safe. And then just notice what happens. If the sensation shifts, that's fine. If it doesn't shift, that's also fine. Because we know it's just a sensation. I want you to breathe with it just for a few more moments. And see if you can soften around the sensation. Soften around it, breathe into it. Shifting from fear to curiosity. Okay, now when you're ready. Okay. So you just did somatic training. Importantly, this is something to do when your symptoms are low. When your symptoms are high, this is not the thing to do, because what you need to do when the symptoms are high is just get through it and soothe yourself. But when your symptoms are low, this is a practice of starting to feel the sensations that are very scary, but more from a lens of safety. So I want to describe to you, I just have a few minutes, but I want to share a patient that I worked with who had severe migraines and really made huge steps in her recovery. Somatic tracking that we just did was a big piece. There's another big piece which I want to explain, which is gradually, and in a safe way, exposing yourself to the things that are triggering you. So for her, as is often the case, any kind of sudden movement of her head was triggering for migraines. She couldn't drive, she couldn't read, she couldn't even ride a bicycle. So one of the first steps was finding what is the thing that really helps her feel safe? What's the thing that really helps you feel safe? For her, it was doing yoga. Doing yoga was something where she could really, even if she had a little bit of pain, she could relax into it. She could not be afraid of it. So, and this was actually an intervention that she came up with. She started riding her bike across campus. She was a student. And as she would start to get a little bit triggered with the migraines, she would stop, put her bike against the tree and do some yoga, calm her brain. So that combination of getting into that place where the brain starts to get scared, the migraines come up, and then effectively calming herself down. So I just wanted, there's a lot more there, but I just wanted to kind of share with you that process. Okay. Are we, I need to wrap it up here?
I mean, you can go like in three minutes.
Sure. Okay. There is another piece here, which another important piece for her, and for a lot of people is emotional expression. And we know that there's a big connection. We know that there's a big connection between emotional pain and physical pain. This is a very interesting study about people who were rejected by a romantic partner and brought into the lab, and they did an fMRI of their brain, and showing them a picture of the person who had rejected them, stimulated, sort of lit up a very similar part of the brain that was lit up with physical pain. And so helping people in therapy, but this is also something people can do on their own, feel emotions that are scary to people. And we know that we know that if there are emotions, if there are memories that you are sort of walling off and avoiding, it can also trigger the brain's dangerous system. So helping people in therapy step into those places that are a little bit scary. And sometimes it can be very helpful to express anger that wasn't safe to express. As Lindsay was saying, it's not a place you want to get stuck in, but it can be very helpful in stepping into it, feeling it, expressing it, and letting it go. And it's not often a place that in therapy for chronic pain that gets explored. So the last piece, and this is what I want to end on. We know that the biggest way to help the brain feel safe, which is really what we're talking about in pain reprocessing therapy, is being kind to yourself. And interestingly, I often find that this is a key part in people's recovery, is learning how to be gentle and kind with yourself, practicing that, learning how to take care of yourself, learning how to put your own needs first. And so I wanted to sort of end on that note of, whatever you take away from this talk, to please be gentle with yourself, please be kind with yourself. So thank you. I do have some resources if people are interested in learning more about this. There's an excellent book, The Way Out. There's an excellent book, The Way Out, which talks about pain reprocessing therapy. And then we also have available this book by Morgan Fitzgerald, which talks specifically about using this approach with migraine, which I would highly recommend. Sorry for all the technical difficulties, and thank you all very much.
Okay, thank you, Dr. Dowd. We're